Hey, what's up guys? Chad with Heal to Be Human. I want to tell you a couple of stories here, specifically about pain and how a lot of this stuff works. But I want to start with the story. So my story is about a real person who was biking in a neighborhood, kind of like this neighborhood here. And as she was biking, being all healthy and doing the cool stuff, she got a flat tire. And unfortunately, when she got this flat tire, it left her stranded, maybe like a mile or 2 miles away from her house. What a bummer, right? So this really nice older gentleman came out and was like, hey, you need help? Let me bring you back to your house. I'll give you a ride in my car. And like a lot of us would do, she kind of hesitated, but she decided, hey, you know what? This man seems nice enough. Let's give it a try. Let's get in the car. And as she was telling me this story, she was telling me all her backup plans. Like, hey man, I'm gonna get the phone number for the local police station. I'm gonna take a picture of his license plate. I'm going to tuck and roll out the window, or the door probably, not the window, in case he tries something fast on me. So as she was describing this potentially precarious situation, it reminded me of how we all do this in all situations and how normal it is, but sometimes how destructive it can be. Ooh, it's getting a little windy out here. So as she was telling the story, it reminded me of how all of our brains do this basically all the time, and how we're always seeking safety and we're making these backup plans and always trying to weigh the evidence for, am I going to be safe versus the evidence of, am I going to be in danger or have pain? Interestingly enough, there's a lot of studies about this. This is one of my favorite studies out of 2010. It's a little old, but it was called the Explanatory Diagnostic Labels and Perceived Prognosis in Those with Chronic Low Back Pain in the Journal of Spine. That's a whole lot of information, right? What that study looked at was individuals with chronic low back pain over 12 months in duration. And essentially what they came up with was that those that use terms like deterioration, damage, degeneration, they actually had worse outcomes both in the short term and in the long term. Now, how cool is that? That if we can change our perceptions, we can change what we think, how we believe, and what words that we use, we can feel dramatically better in all sorts of life, but especially pain. Think about me walking around right now. I probably chose this neighborhood because it feels safe. Maybe it's way too windy out here, but other than that, I feel that this environment is comforting. Everything looks good, and I decide, like, you know what, this is a safe place to do a video like this. So I am weighing the evidence for danger and safety. Maybe I weigh my own internal evidence for danger and safety, like, am I fatigued? How did I rest? Do I feel inspired today to do a video like this? So at all times, we are all doing this. And when it comes to pain, it's actually pretty cool, at least I think, because when we can get more and more evidence for safety, we oftentimes experience less pain. And there's a tons of evidence and research surrounding this idea. And the whole reason that I'm walking around in this specific neighborhood is because I picked it, and because there's a really cool sign that I'm a big nerd, and when I was walking around earlier, a couple weeks ago, I think it's perfect. So I'd like to share this sign with you. Again, pain, weighing, danger, and safety, exactly like that bad boy right there. One kid on either side, and weighing back and forth, looking for the evidence for danger and safety. I want to talk about another example. How else do we do this in the real world? Well, here in the Great White North, it snows a lot. Sometimes it rains really hard. Maybe wherever you live, you've gotten crazy weather, and you've decided maybe it might not be a great time to drive and go out on the road and maybe go visit a friend or go get some food. Well, at some point, you decide to weigh the risks and the benefits. Or I'd like to say, weighing evidence for danger and safety. We do this all the time. So I challenge you as the individual to see if you can expand your own knowledge about how we can utilize this to heal from persistent pain, or just help our understanding when it comes to any type of pain. My example with that study was low back pain, but there's all sorts of other examples. We've got another study. Who doesn't love studies? This was a study back in 2003, and they were looking at what are our levels of knowledge when it comes to pain. And this was actually a pretty neat study. There were about 300 providers, like physical therapists, physicians, etc., and there were about 300 patients. And what they found in this study was pretty cool, and this is the reason that I brought it up, is they found that, one, most of us, both patients and providers, don't really have a good understanding of pain. And you can see how that can be problematic. What they also found was this poor understanding of how pain works makes our outcomes, our treatments, our programs for pain management and quote-unquote pain rehabilitation make it a lot less valuable, because maybe we're having the wrong message. Maybe we're giving people the wrong information about what we know from the science and from the research. So I want you to think about everything that we covered in this video. As a brief review, what did we chat about? Well, we talked about a whole lot of things. We started first talking about the terms associated with that first study from 2010 and how labels and scary terms can actually make us worse. And then we talked about a story about one of my patients. We talked about weighing danger and safety. We used that cool little sign that I showed you. And then at the end here, we pulled it all together and we said, you know what? We don't know much about pain, but if we start learning more and more about it, I really think that pain is just a tip of the iceberg. How could we reframe our thoughts and our beliefs that drive actions and behaviors that give us a healthier lifestyle, but at the end of the day, just make us feel good? So again, my name's Chad. Do all the cool YouTube stuff, like, subscribe if this was helpful, and please leave some comments if you find this valuable, or if you have any questions or just want to kind of start a conversation. So thanks for your time and have an awesome day.